Good evening. My name is Claudia and I'll be discussing the Puerto Rican culture. I decided to do the culture presentation on Puerto Rico because I am half Puerto Rican and it is very near and dear to my heart. First thing we'll be discussing is geography. Puerto Rico is a very small island. It's in between Dominican Republic and Virgin Islands. The Dominican Republic is 50 miles away from Puerto Rico, and the Virgin Islands, is 40 miles away from Puerto Rico. And land-wise with Florida, it is 1,000 miles away from Florida. Communication, the official language is Spanish and English. We're a very affectionate culture, and so when you see an individual speaking to another individual, you'll notice that they will stand close when speaking, and also a contact culture, which means we're very hands-on, affectionate. It is not abnormal to see someone greet another person with a hug or kiss or even handshake. And also, we often speak not in turn. So during a conversation, you may observe two people talking at the same time. Family roles in organization. And here in the U.S., the family consists of the immediate family, the mother, the father, the brother and sister. In the Puerto Rican culture, we involve the extended family. It is not abnormal to see a lot of generations living in one household. For example, I have a cousin that lives in New York, and they live in the same household and different stories. So the first story my cousin lives in, and second is her mother, and the third story is my uncle. That is very common in our culture. Children also usually do not leave the house until they're married, and like I said before, grandparents usually live with the family. The physical characteristics of skin and color is Puerto Ricans are a very diverse culture. So you'll notice there's a blend of cultural heritage such as Tiano, Indian, African, and Spanish, which makes us very diverse. The common diseases that you'll see in the Puerto Rican culture or even Hispanic culture is heart disease, diabetes, chronic liver disease, and kidney disease, diabetes being the most prevalent in the Puerto Rican culture. Nutrition, food plays an important role in our culture. We love to have gatherings with friends and family just to celebrate life, and usually we will share the same holidays as the American holidays with a Puerto Rican twist. We'll use our own seasonings. The most common ones being sofrito and adobo. We also use this type of seasoning called achote, which makes the rice yellow, bright yellow. And the foods are influenced by Spanish, African, American, and Taino heritage. Common foods consist of rice and beans being the major staple. You would also see at the table stew, plantains, fish, and beef. Childbearing rituals. According to the CDC, this was based on statistics in 2014. The population of Hispanics had the highest teen birth rates from the ages of 15 and 19. The Puerto Rican culture celebrates children. Usually when you do get married, it is a general consensus, both the husband and wife want children. However, in prenatal care, it's often is neglected because in the culture they think pregnancy is a normal way of life, so that prenatal care is not needed. And they often use midwife in their labor and delivery. Also in childbearing rituals, like I said before, the family, including the extended family, is very important. So it's not uncommon to see the mother-in-law have a very strong bond with the daughter-in-law. And also during labor, You may see that the mother may be part of the labor and delivery experience instead of the husband. And newborn babies are often presented with a special bracelet with a black fist charm that's supposed to ward off evil spirits. Now, death rituals, vigils, they do believe in vigils or wakes. They are predominantly Catholic. What they do usually is close friends and family will gather together to hold a vigil and pray the rosary for the deceased. Now, after, also, candles are lit in memory of the deceased, and they continue to pray leading up to the burial. So you'll see in the churches that they'll dedicate candles for the deceased in memory of them, of him or her. So also after that, they will have what we call novenas, which is 9 days of prayer. So after the loved one is buried, they will pray for 9 days consecutively in the deceased house or the family member's house, so that it can also show favor for the remaining family members and also pray for the soul of the deceased. Health risk behaviors. They have health risk as behaviors as smoking, alcohol abuse, and obesity. Healthcare beliefs and practices. The Puerto Rican culture believes heavily on balance and harmony and equilibrium, and if anything is in balance, it can cause disease. So what's really common in the Hispanic and Puerto Rican culture as well is the hot and cold theory. They believe that there are certain diseases that are called hot illness, which can be treated by remedies or cold foods. Also with the cold, there's also cold illness, and it's vice versa. Be treated with hot foods and remedies. So they also believe in unnatural and natural diseases. What they believe is for unnatural diseases, it can be caused by sorcery. Now we're going to go through nursing implications. We're going to go through nursing implications for culturally competent care. So when you are dealing with any culture, you really have to be very open-minded and listen to the different types of cultural beliefs that your patient may believe in. So that means learn the rituals or customs. I know that in nursing we have limited time, but if you just take time to listen in what their beliefs or practices and why, it helps you give you a better understanding of that patient. Appreciate their diversity as an asset rather than a hindrance. And also you really need to look at your personal beliefs and biases and prejudice when you're taking care of a patient from a different culture. Also, as I said before, you must respect and convey and cooperate with traditional healers and caregivers. Sometimes we'll have patients that do believe in traditional healers, and we have to try to incorporate that with the plan of care. Also, that means with their cultural symbols, they may have, like I said, with newborn babies, they like to present that bracelet that means a lot to the family. It means that, you know what, we just may think of it as a charm. They link it to their spirituality, that it will basically ward off the evil spirits and give the baby good luck. So you have to do a cultural assessment of the client and family as part of your overall assessment. Now we're going to go, the last but not least, we're going to discuss ethical considerations for the culture. The question that I have is, what would a healthcare professional do if the client will not follow the physician order or take prescribed medications due to his cultural background? We kind of did discuss, briefly how you would handle a patient with a different culture. A nurse or a healthcare provider must be very empathetic and listen to the client's perspective regarding healthcare and treatment. The nurse may also need to basically, recapitulate what she has heard from the client to make sure that she has clarity and understanding of the client's needs. Next slide. Also, negotiate with the client. The nurse and the client must also work together to incorporate their spiritual beliefs with scientific beliefs. According to Blas and Hayes, it states that if the client's views reveal that certain behaviors would not affect the client's condition adversely, then the nurse can proceed and incorporate their views in planning of care, because that will decrease, to me, anxiety. It will generate a positive patient outcome. Because imagine if you were in a different role, if you were in their shoes, and if you were in a country that you're not familiar with their culture, you would want someone to incorporate your beliefs into the plan of care. Next slide. So basically, to wrap everything up, is that when you have when you have a patient from a different culture, just keep in mind their beliefs, and if it does not affect their plan of care, then you can proceed with what makes them feel better. However, if you do have an incident that it will affect the plan of care adversely, then that's the time you would try to negotiate with the client and try to explain to them the scientific aspect of care. And if that doesn't work, then you're going to have to closely monitor the patient and intervene with maybe the family to discuss what's going on in the plan of care. And that includes my presentation. Thank you and have a good night.